My first back issue was actually in 2002. I was bending over the sink putting mascara on and apparently pinched a nerve. I ended up having an artificial disc put in. It was part of an FDA study. It was called the Maverick. And I gradually started having some pain. When I finally went to Dr. Carlson, I had not basically had a night's sleep in 2.5 years because laying down made it so much worse.
Susan came to me after having a lot of back pain and leg pain. She was almost invalid with the amount of pain that she was having down to the back and to the leg. She had had a disc replacement done several years before and had done very well. At that time, it was a new technique, so she was someone that was looking for a better way of doing things.
He first discovered the implant I already had fused itself. It was not moving anymore. That had put more pressure on the one above it, and that was where the problem was.
One of the thought processes in disc replacement is if you have a disc replacement, you'll be able to preserve the other levels. And obviously she didn't. The disc above went bad.
The disc was basically desiccated. It was gone.
So we discussed what our options were. Certainly there's another option to do a disc replacement. A lot more scar in the front, so it's a bit more difficult procedure going in through the front than it would be from the back.
When he said the word fusion, I'm like, oh no, because I can't be able to work that long.
We know spine fusion works. We know that putting in screws and rods in someone's spine to stabilize the bones stabilizes the bones. That's the whole idea behind the procedure. So surgeons, when they have a procedure that works, are reluctant to change that. The less exposure spine surgery is really the same traditional approach without causing all the trauma to the muscles and tendons.
You're not getting all the surgical damage in addition to what you already had there.
Her mindset has been, let me do something that's smaller, outpatient, and get this thing fixed. Doing the less exposure spine surgery was right up her alley.
If I had known about it, or if it had been around earlier, I'd have done it in a heartbeat if I had known about it. And a lot of people like me, when they hear the word fusion, they're gonna go, no, not doing it.
So we were able to do this procedure, fix her leg pain. She woke up from the surgery with no leg pain, and she was able to leave the hospital within a few hours. She was more impressed with that than she was the disc replacement, which was the fancy new gadget at the time she had it put in.
Once I had the surgery, I could do it all again. I can do everything now that I used to do 20 years ago, and I like that. I like being outside, I like being active, gardening, hauling stuff. I amaze people that I can pick things up that are heavy.
SpineFrontier has been a leader in the less exposure spinal surgery market. So they've really been focusing a lot of their techniques on providing less pain for patients. When you tell them this is going to be a similar procedure, but you'll be up and around that same day, they're very happy to have this done. Susan's one of those patients that proves that.
To say you have pain because you're getting old, that's no excuse. It's worth checking out.